Hello, I'm Dr. Robert LaDouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about mammograms. So, when should you get a mammogram? How often should you get it? It's a little bit confusing, and the guidelines change on a regular basis. So, take the specific numbers that I tell you today with a grain of salt, because in a few months this may not be completely accurate, but I'm hopefully going to give you some general guidelines. First of all, there are at least 4 main bodies that recommend mammograms, and each of them have slightly different variations. So one of the recommendations is to get a tailored answer from your physician. So we recommend that you see your physician and get information customized to you, but in general, as it stands now, the recommendation is to get your first mammogram at 40 years old. There used to be a recommendation for a baseline of 35. That's no longer the case, so that might change. This is assuming someone of average risk. So if you have, for example, a strong family history or an increased risk, then there's a recommendation to get it 10 years younger than the age of the youngest person in your first and second degree relatives who had breast cancer. So if you had somebody who had, if your mom had it at 38, then you would be recommended to get it at 28, okay? But if you have that kind of risk factors, you certainly need to be discussing this with your physician. The recommendation in the 40s to 50s, there are many different recommendations. One is not till 50, another is every year in the 40s, another is every other year starting at 40 or even at 45. And that's where, because of the conflict and the lack of agreement, they've suggested in the 40s to get a tailored answer from your physician. And the reason for that is the studies that say you don't need it in your 40s point to the fact that they've done some studies showing that whether you get a mammogram or not, if you get a breast cancer in your 40s, that the long-term survival rate is the same. And the counter argument to that is, while that might be true, what you actually have to do to get survival is different. So if you get yearly mammograms, then a breast cancer will be caught early, and you may only need a small lumpectomy, maybe some radiation, keep your breast, don't need anything more. If you wait till you find it on exam, or a doctor finds it on exam, it's more likely to be more advanced, and then you may end up needing a double mastectomy, radiation and chemo. Maybe you'll have the similar survival outcomes, but a lot bigger impact on your life, a major surgery, more cosmetic impact. So that's part of the argument why I am actually a big fan of regular mammograms in the 40s, yearly or every other year, perhaps depending on your risk factors and your particular situation. And for example, if you've done things that reduce your risk. So if you breastfeed for 4 months or more, that reduces your risk of breast cancer by 50%. Also reduces the risk of ovarian cancer. So it's complicated enough. Rather than taking an absolute number from this presentation, what I want you to take home is that mammograms are very important, and if you're at higher risk, you should get information sooner, but you should definitely be thinking about it and getting some answers from your physician at 40 years old. Now, what about 50 to 70? Well, this relatively recently has changed, and mammogram reports often say yearly, but some say for an average risk woman, it would be every other year from 50 to 70. So again, get an answer from your physician, but there is some flexibility there, and that might change as well. The question, what about after 70 or after 75 or after the 80s? And generally speaking, the mammograms are suggested to be continued as long as your life expectancy is within about 10 years. Bottom line is, we are very lucky to have mammograms. They are quite helpful. They don't solve all the problems. Sometimes if you're higher risk, you might need to get an MRI. In addition to a mammogram, you might need an ultrasound, but I encourage you to discuss it with your physician to decide if you're appropriate for mammograms. Also, if you're higher risk, I also encourage you to discuss the BRCA testing genetic screening, and there are 2 other videos on my site that discuss that as well. I hope you found this helpful. Please leave your comments. Thank you.